Structure under siege. 10 causes of bone diseases. Bones, the framework of life, giving shape, protection, and support every movement. They store minerals, produce blood cells, and enable strength and mobility. Yet, just like any vital system, bones can weaken, fracture, or deteriorate, silently compromising health. Bone diseases affect millions globally, from children to elderly, causing pain, deformities, and disability. Osteoarthritis, bone cancer, rickets, and Paget's disease are just a few examples of conditions that disrupt the skeletal system. But why do bones fail? What silent forces erode this strength? So today we review the 10 major causes of bone diseases, exploring how they develop, who is at risk, and how prevention can safeguard this essential structure. Number 1. Calcium and vitamin D deficiency. You see, calcium and vitamin D are the cornerstones of bone strength. Calcium provides mineral foundation, while vitamin D enables absorption from the gut. So, deficiency leads to weakened bones, brittle structures, and increased susceptibility to fractures. Children may develop rickets, resulting in bowed legs, while adults risk osteoporosis and osteomalacia. Some sources of calcium include dairy, leafy greens, and fortified foods. Vitamin D comes from sunlight, fatty fish, and supplements. Adequate intake throughout life is critical for maintaining strong bones. Number 2. Aging and hormonal changes. Look, aging naturally reduces bone density. After the age of 30, bone formation gradually slows, while resorption continues, leading to net loss. So, hormonal changes, especially decreased estrogen in postmenopausal women and reduced testosterone in men, accelerate this process. Osteoporosis, the silent disease, often emerges unnoticed until a fracture occurs. So, regular bone density scans, weight-bearing exercise, and hormonal management can mitigate age-related bone loss. Number 3. Genetic predisposition and inherited disorders. Look, some bone diseases have a strong genetic component. Osteogenesis imperfecta, known as a brittle bone disease, results from inherited mutations affecting collagen production. Other conditions like familial osteoporosis also run in families. Being aware of genetic risks allows early monitoring, preventive implementation, and interventions to maintain bone health. Number 4. Inactivity and sedentary lifestyle. You see, bones are living tissues that respond to stress and load. Lack of physical activity reduces mechanical stimulation, slowing bone formation and increasing fragility. So, weight-bearing exercises, resistance training, and even daily walking strengthen bones and preserve density. A sedentary lifestyle silently erodes skeletal strength, increasing fracture risk with age. Number 5. Excessive alcohol and tobacco use. You see, alcohol interferes with calcium absorption, reduces vitamin D activation, and increases bone resorption. So, tobacco introduces toxins that compromise bone cells and blood supply. Chronic alcohol and tobacco use are strongly associated with osteoporosis, delayed healing after fractures, and increased risk of skeletal disorders. Therefore, lifestyle modification is key to preserving bone integrity. Number 6. Nutritional deficiencies beyond calcium. Look, bone health depends on a range of nutrients beyond calcium and vitamin D. Protein is essential for the bone matrix. Magnesium, phosphorus, vitamin K, and trace minerals like zinc are critical for both formation and maintenance. Poor diet or malabsorption disorders can deprive bones of these essentials, leading to weakness and deformity. Balanced nutrition supports lifelong skeletal health. Number 7. Chronic diseases and medications. Look, certain chronic illnesses and medications compromise bone integrity. Corticosteroids used for autoimmune conditions accelerate bone resorption. Chemotherapy and radiotherapy can impair bone growth. So, kidney disease alters calcium-phosphorus balance, reducing mineralization. Therefore, understanding these risks allows physicians to implement bone protective strategies, including supplementation, medication adjustments, and regular monitoring. Number 8. Trauma and repetitive stress. Look, acute trauma or repetitive stress can initiate structural damage in bones. Fractures, stress injuries, and microtrauma, if not properly treated, may lead to long-term skeletal disorders. Athletes, laborers, and individuals in high-risk activities must therefore prioritize protective gear, proper training, and timely medical care. Number 9. Infections and inflammatory conditions. You see, bacterial, viral, or fungal infections can infiltrate bone tissue, causing inflammation and destruction. Osteomyelitis is a severe infection that weakens bone structure. Chronic inflammatory diseases like rheumatoid arthritis also degrade joints and bones over time. So, early diagnosis, antibiotics or antivirals, and managing inflammation are essential to prevent permanent skeletal damage. Number 10. Bone cancer and tumors. Look, primary bone cancers like osteosarcoma, Ewing sarcoma, and chondrosarcoma originate in bone tissue. So, secondary or metastatic bone tumors spread from other organs such as breast, prostate, and lung cancer. So, these tumors disrupt normal bone architecture, weaken the skeleton, and eventually cause pain and fractures. Therefore, early detection, surgical intervention, and oncological treatments are critical for survival and skeletal prevention. You see, bones form the foundation of our bodies, supporting every step, jump, and movement. Bone diseases are often silent, cumulative, multifactorial, yet knowledge is power. Understanding the 10 causes, calcium and vitamin D deficiency, aging and hormonal changes, genetics, inactivity, alcohol and tobacco, nutritional deficiencies, chronic diseases and medications, trauma and stress, infections and inflammation, and bone tumors empowers prevention, early detection, and treatment. Strong bones allow a strong life. Invest in nutrition, movement, and medical care today so your skeletal system can carry you safely through every decade of life.